The glenohumeral joint has the widest range of motion in the body. Therefore, it needs to have stabilization mechanisms. One of the main mechanisms is the rotator cuff muscles. Hi, this is Adel Hajjai from the Anatomist. In this channel, we are helping medical students to enjoy and understand human anatomy. If you are new here, consider subscribing. The rounded humeral head is articulated with the concave glenoid fossa of the scapula, and it's held to the fossa by compressive action of the rotator cuff muscles. In addition to that, the rotator cuff prevents the lax capsule and the lining synovial membrane from being nibbed. With the other short scapular muscles, the rotator cuff assists fixation of the proximal end of the humerus during movement of elbow, wrist, and hand. Around the shoulder region, there are a huge groups of muscles that principally produce movements at the glenohumeral joint, like the scapulohumeral and thoracobrachial muscles, in addition to deltoid, pectoralis major, and latissimus dorsi. The rotator cuff muscles counteract the moving action of these muscles on the shoulder joint. The rotator cuff muscles are a group of short muscles that includes Subscapularis, Supraspinatus, Infraspinatus, Teres minor. And for better understanding, let's dive in and walk through the gross anatomy facts regarding those muscles. Number 1. Subscapularis. It's a bulky triangular multipennate muscles that originate from 2/3 of the subscapular fossa and from the intermuscular septums in the medial margin of the scapula. Then, the fibers converge laterally and get thicker and inserted into the lesser tuberosity of the humerus and the medial lip of the intertubercular groove for almost half an inch below. The subscapularis muscles innervated by upper and lower subscapular nerve from the root C5 and C6. Regarding the blood supply, it's supplied by small branches from the suprascapular, subscapular, and axillary arteries. In action, as a prime mover, it's a medial rotator for the humerus. Number 2. Supraspinatus. The supraspinatus is a bulky bipennate muscle, and the arrangement gives it a significant force to pull up the arm. It arises from the medial 2/3 of the supraspinous fossa of the scapula and from the supraspinous fascia. And the fibers converge into a thick tendon, then passes under a chromium process of the scapula and crosses above the humeral head. Some fibers blended into the joint capsule before it got inserted into the superior facet of the greater tuberosity of the humerus. The supraspinous innervated by suprascapular nerve, C5 and C6. It's supplied by suprascapular and dorsal scapular arteries. In action, it initiates the abduction. It abducts the arm from 0 degrees to 15 and 18 degrees. With the arm moderately loaded, supraspinatus assists deltoid in preventing downward displacements of the humerus. Number 3. Infraspinatus. It's a thick triangular muscle. It arises from the medial 2/3 of the infraspinous fossa and from the deep surface of the infraspinous fossa fascia. Its tendon passes under the lateral part of the spinous process of the scapula and crosses the posterior aspects of the capsule to be inserted into the middle facet of the greater tuberosity of the humerus. The infraspinatus receives its nerve supply through the suprascapular nerve C5, C6 as well. Regarding the blood supply, it's supplied by suprascapular and circumflex scapular arteries. In action, the infraspinatus considers the main lateral rotator of humerus. Number 4. Teres minor. It's completely hidden beneath the deltoid. It arises from elongated round area at the lateral border of scapula. Then it passes upward laterally to be inserted into the lower facet of the humerus, and the insertion extends to finger breadth below. Teres minor may be fused with the infraspinatus. The teres minor is innervated by posterior branch of the axillary nerve, C5 and C6. Again, regarding the blood supply, it's supplied by circumflex scapular and posterior circumflex humeral arteries. In action, it acts as a lateral rotator and weak abductor of shoulder. One of the most painful conditions in the shoulder region is the rotator cuff disease, and its etiology is multifactorial, but severe or chronic impingement of the rotator cuff tendons below the coracoacromial arch is the most significant factor. In this case, supraspinatus tendon is the most affected tendon by the impingement, which commonly causes to reduce blood flow in this tendon. When the impingement is associated with tendinopathy from age-related degenerative diseases, in this case, the impingement may cause complete or partial tears of the tendon. Clinically, the rotator cuff disease causes pain and tenderness over the anterior aspects of the acromion process of the scapula. The pain typically occurs on the abduction of the shoulder between 60 and 120 degrees. This is known as the painful arc. Thank you so much for watching this video, and if you like it, don't forget to hit the like button and let me know in the comment below if you want to discuss a certain topic. See you in the coming video.